any better?
Yeah, yeah, it's better.
Okay. So I think we'll start, and hopefully my net continues to support me in this. A very warm welcome to you and to all the followers that have joined us today. We are on behalf of Team Triumph, trying to eradicate the stigma associated with mental health while also creating an awareness about the different mental health issues that exist in the society. And today we have Dr. Charan with us. He is a renowned neuropsychiatrist from Hyderabad. He is a consultant at Kim's Hospital, and he's also involved with international schools for sex education and is teaching stress management strategies to multinational corporations. And on behalf of the whole team, I would like to give you a very warm welcome and thank you so much for taking the time and doing this for us, and speaking on World Suicide Prevention, month. So thank you so much. Yeah. So without any further delay, if you don't have anything to say on the topic, I think we have a couple of questions with us, so we can start with that. And then take it
Your voice is breaking.
Is it better now? Can you hear me?
Your screen is completely grainy and it's frozen. I don't know if it's just me or people who are watching as well. Can somebody text in the comment section if...
Yeah, just say if it is clear.
If it's clear or not, or is it a problem from my end, because I would like to correct it. Yeah, I think you can ask me. Let's see if I can hear.
Okay. So the first question that we have for you is that why are the number of deaths in the younger age groups due to suicide on a rise? And has social media usage and accessibility made them more prone to suicidal tendencies?
Okay, so first part of the question is why has there been increase in the suicide rates in the youth?
Yes.
Okay, so I was going through some of the numbers. So it's very alarming that a lot of studies done between 2007 to 2018. This is much before the pandemic, not much before, a year before the pandemic, had shown that the suicides have increased by 64%. 64% increase is huge number. That's almost like 6 to 7 times increased in youth. Whereas that number is even more skyrocketed in the pandemic in the last 1.5 to 2 years. We don't know the clear number in the last 2 years yet because pandemic is still on. We are nowhere close to post-pandemic time. So I think from the numbers what I saw, clearly there is increase in the suicide rates in the youth. Why? It's because I think it's multifactorial. It's combination of many factors. First of all, if you look at adolescence is a period of identity formation. It's a period where you feel like you have to belong. You have to belong to your community, belong to your friends group, belong to your family. A lot of pressure is also put on youngsters, mostly from the environment around, and also self-induced pressure also is very common in this age group. Right now we are living in a competitive world. Back in the day, things are very relaxed and very laid back. Now, when you look at it, there's always somebody better than me. So my constant goal and motivation is to catch up or even do better than that. I think that kind of stress and pressure definitely drives youth into taking such drastic measures, because I think I was actually looking at, I in fact posted a video today where a lot of medical students from state of Tamil Nadu are losing their lives to suicide. We don't know if it's impulsive, we don't know if it's exam-induced stress, we don't know if it's pressure from the family. We don't know. And also, the second part of your question, has social media worsened it? See, I think socially made us connect with the world more, but also made us more lonely at the same time. I don't know how to explain this. I think people understand what I mean. We have way too many friends on, like, Facebook, Instagram, so many followers, but in real life we don't know too many people. Even we look at some of the influencers with a lot of followers. Um, some of them I know personally, and they're very introverted, and which is, there's nothing wrong with that, but still they're very introverted. They have some of them have social anxiety. They can do well one-on-one on in front of their screen or a device, but in real world I think a lot of people find it a lot more difficult to find their feet or find their niche. It gets difficult. So may have increased some of the suicides, not directly, but due to increase in loneliness or pressure to belong, a particular sense of beauty or body image or success, etc. For example, I'll give you an example, because we're all always looking or following people who are better than us, or at least whom we think are better than us. People who are better looking than us, or people who are more successful than us, people who have a lot more followers than us. That does create sense of loneliness. Sometimes you tend to feel like you feel worthless in compared to someone else. I think that also can drive people to go to that step. But again, it's two sides of a coin. Social media can also give you wings to fly and meet like-minded people, or become part of a community that you want to become part of. For example, if you look at people from LGBTQIA community, you know, in real life they can never find their allies or the supporters or somebody from the community. But I think social media does give a chance for people to find others. So it's a double-edged sword, or two sides of a coin. So it can be this or it can be that, is my perspective at least.
That makes sense. Have you, by any chance, identified factors are which have developed newly during this pandemic? I mean, there have been existing factors like you're saying, but has the pandemic led on to some more element of stress which has led to increase some? Is there any factor which has come newly to light?
Your voice is very broken. I'm sorry. So you're asking me if the pandemic has increased rates of suicide?
No, I mean, I'm saying, are there any causes that have come to light, or is something different that the pandemic has shown which contributed towards increased suicide?
I think a lot of people who are, correct me, I think I heard your question, but you can stop me if I think I'm not answering to the point. Has pandemic, what are the factors or relation between pandemic and suicide? Yeah. See, I mean, from the patients that I'm seeing, a lot of people are definitely struggling with their mental health, at least in the initial parts of the pandemic, because it's a sudden change. And a lot of us, we don't adapt to change that well. Some of us adapt very smoothly, but a lot of us usually don't. I think people who are having mental health issues, who were having social support, or who were going out and having a regular life, 8 to 4 job, and after that they would like catch up with their friends. People didn't really sit back and had time to sit back and think about their mental health issues. I think now with the pandemic, I think some people have time to actually introspect and process and understand, like, if they are having mental health issues. I think that's one of the reasons where people are knowing that, okay, you know what, there's something called as mental health. This is what is mental health. That includes my thoughts and my behavior. Maybe I'm not thinking too well, or maybe I'm not behaving too well. I think definitely pandemic has put the mental health on a forefront than before, if you ask me. Was suicides increasing? Definitely they're increasing for sure. I think fear of contracting the illness itself had led to many suicide attempts in the beginning. Um, when um, I think last year somewhere in the month of April and May, at the same time they had alcohol. At the same time,
Right.
I think some of them had a lot of withdrawal symptoms and came with multiple suicidal attempts.
Right.
Whereas some of them had sudden loss of job and insecurity in terms of how am I going to pay my EMIs? How am I going to take care of my family? Especially if your financial condition is not that good and if you don't have savings. Uh, Also, I think many sectors of were drastically affected. Talk about transport or agriculture, everything. A lot of things got affected. Also, for students also, suddenly if you have to go back to online classes, which is very
Right.
difficult. They are having to sit in the house 24/7. That is the time where there's a life. You put all of them in one room and ask them just, you don't have anyone to talk to. Your both parents are working and they're busy. There is no one that you can share your feelings with. Um, just sit like a robot in front of online class and listen to it and mark your attendance. I think multiple factors had definitely led to increase in suicide attempts in pandemic, I think. But people who are doing well are doing well. I'm not saying pandemic equates to suicide. Some of us are not doing well. Some of us are doing well. It's individual vulnerability and susceptibility also.
How do you identify the warning signs in a suicidal?
Okay, so you're asking me about warning signs of the suicide, right?
Yeah.
I think the first important warning sign would be if somebody expressed a wish to end their life, that itself it's not even a clue, it's a direct cry for help. The fact that somebody had expressed it to you, that means they don't want to die. A lot of them, they
Right.
don't want to die. They don't want to end their life. They are asking for help. They're not knowing any other way to ask for help. So don't
Right.
take it with pinch of salt. Take it for as it is and understand that there is an imminent danger or risk or threat to that person's life, and we have to act accordingly, just like how we would treat a medical emergency. If somebody's
Right.
saying that I'm having sweating or I'm having pain in my left shoulder, immediately rush them to the hospital thinking it could be a cardiac arrest. Same way, somebody has expressed a suicidal intent or wish to end their life. I think you have to take it for what it is and act accordingly. That's the first warning sign, expressing the wish. Second thing is, if you're getting messages like they're going to leave, any kind of goodbye messages. It could be through online if they're posting things on online about their pain, which is never ending. It's or any messages that show that there is no hope. Somebody feeling hopeless or unworthy, especially at odd hours of the night or day, somewhere in the late night or early in the morning. That's when a lot of people feel more lonely. Also, lack of light makes you feel more depressed. There's a lot of neurochemistry behind it. I think at that time we had to be more cautious posting any messages like that. Or somebody who is in a lot of depression, right? Severe depression, suddenly is feeling very relieved. I think a lot of people. I think this is a very new point for a lot of people. If somebody is feeling very depressed and one fine day they have sense of calm and relaxation, don't think that depression has gotten better in overnight. No, maybe they wish to end their life and their pain and suffering. That's why they're feeling relaxed. Probably, you know, I see this pattern in a lot of my patients as well. I never give credit to myself that, oh, my treatment is working very well. Suddenly, when I see drastic change in their mood, it's uplifted. I immediately tend to think that, probably there is a suicidal intent. That's a warning sign itself. Or somebody in the older age group, if they're, taking care of the affairs, for example, if they're writing a will to their, kin and kith, if they're going and meeting their friends saying that, I want to meet you guys, it's been so long, for one last time or something like that. If people are taking care of their any affairs, properties, etc., that could be a warning sign. Somebody who suddenly increased use of alcohol or smoking or any other drug use drastically out of nowhere. It's not a gradual increase, sudden increase. That could be one of the warning sign. If somebody is suddenly withdrawn from the society, somebody is not taking your calls, not staying in touch with you, not posting anything on social media. Very unusual for that particular social behavior of that particular person. That could be a warning sign again. So I think all these could be warning signs. Yeah. Also, somebody who had attempted suicide before, that itself could be a warning sign. In the face of stress, good chance that they might take that step once again. So these are few warning signs I could think of.
Okay. So, what if someone is actually is troubled but is having difficulty expressing it, or is not really vocal about their feelings? Then what do we do in such a case?
If somebody doesn't want to express, like say I'm a person who don't express too much, if I'm going through something by myself, I would ask, the friend or family member or anybody to just stick around to the person, stay with the person. Sometimes I think having the physical comfort of somebody around you itself will reduce the loneliness. Sometimes it's not about talking, processing, analyzing your thoughts. Sometimes it's just having presence of another person in the room. It makes a big difference to somebody's mood. Somebody's not expressive, just let them know that you're there for them and mean it. We all say that I'm here for you. It's a very, it's become such a common terminology where we are saying it's okay to be not okay. I'm here for you, etc., etc. But how many of us are actually here for our friends? Because we ourselves are going through our own battles and stresses and insecurity. I don't know if we're there for any of the people who need. So be genuine in terms of saying that I'm here for you, and mean it, and actually be there for them. Check on them, tell them that I don't want to pressurize you. I'm not curious about understanding what's happening with you, but I'm here for you. If you actually want to talk it out, I'm here for you. And just know that this pain what you're going through, it is temporary. It's not going to be forever. I promise that. I'm going to help you with that. We're going to go see a doctor. We're going to see a therapist. Use the word that makes them not feel alienated. I will take you to a doctor. I will get you therapy. Don't say that. Just say we. I think the word we has such a strong impact in feeling like, stress is normal. Wishing to end one's life could be a normal thought. I'm sure, like, I have thought about it sometimes in my life in the face of stress. I'm assuming maybe you must have felt it sometime in your life. We didn't act on it, of course. So I think simple, honest, and genuine efforts like that would go a long way if somebody is not really expressive. Or you can ask them to express it creatively. You can ask them to sit and paint with you without any subject. Paint out your feelings. Or you can ask them to write what they feel and ask if it's okay if you want to take a look at what they've written, or ask them to just write. Sometimes I think penning out our thoughts will give us clarity. If I'm sitting and thinking 1,000 things, my head can go from one place to another place, and it can be a chaotic mess. But if I'm writing down things at a pace, obviously I can't write as fast as I think. So when I'm writing, I think it itself gives me a perspective that, okay, you know what, I think I'm being very sensitive about this. Maybe this problem is not too big for me to even think. I'm not that I'm saying any problem is big enough to end a life, but it'll give a little more perspective. I think something like that would be great. Somebody's not expressive.
Right. So actually, I had a friend of mine who was suicidal. The thing is that as medicos, the first instinct is that, okay, let's go to the doctor, or let's go to a psychiatrist, or let's go to a psychologist. But I think most of the times it ends up triggering them more. So in such a situation, how do you handle, like, because it's like walking on thin shells, right? You don't know what can trigger them. So are there things what is the right thing to say to them at such instances? Because I'm not really sure.
This is a question that I've been getting a lot of.
I'm not really sure that most of them are receptive to therapy or to medications or, other modalities of treatment. So what is the right thing to say in such a situation?
See, talking about receptive, I think most of them will definitely respond and improve for sure. But before that, when somebody says that, I'm having these kind of thoughts, you can't suddenly say that I'll take you to a doctor or I'll take you to this thing, because they usually people gather so much courage to tell this one particular person that I'm not doing well. Immediately, if you say that I'm going to expose you to another stranger who is a doctor or a counselor or whomsoever, I think they won't be comfortable. That won't go down very well. Instead, what you could do is, um, again, see, there is no right thing to say. There's no line that you can say that will change somebody's life. I think genuine efforts will go a long way. Making them feel less lonely will go a long way. Once they're better at that particular point, later we can get them to treatment. See, you can compare it with any physical health condition. If somebody's sugar dropped a lot, right? Let's just say they're having seizures or fits or because of sugar, hypoglycemia. Immediately, you don't pull them and drag them and take to a doctor. First, you would give them maybe a spoon of sugar or maybe a bar of chocolate for their sugar levels to be stabilized, and then you'll take them for a help. It's the same way here. First, give them some ray of hope. Tell them that it's normal to feel that way and it's normal to seek help. I think then they'll be more receptive to see a doctor. But before that, I think there's no right thing to say. I think you just have to be there and let them know. First of all, let them know the pain is temporary. Most of the people would want to end their life thinking that there is no problem, solution for their problem. That's the first thing. They think this is a situation, that this is a do or die situation for me, and I have no hope. Things are not gonna get better for me. So brain tends to give you a lot of negative signals. You are hopeless, you're worthless. What you could ask them to do is, ask them to say it out loud along with you, saying that, I'm worthy, I have hope, I can find solutions to my problems. These are called affirmations.
Right.
You can also say it out with them. So they feel like that there's a belongingness to somebody that they're talking to, and saying it out, they can believe what they're saying. Something like that can help. Firstly, don't be judgmental, because when somebody is expressed a wish to you that I wish to end my life, immediately our friends, out of good concern, we tell them what is wrong with you, what will happen to your parents, or what will happen to what will happen to your wife. You can't do stupid things like that. That's not validating anybody's pain. That's not validating their suffering. That's absolutely judgmental. That's not being empathetic at all. I think here our focus has to be the person, not their family or spouse or their children, not them. First it's about that particular person, and then we can talk about many people love you. Your parents love you, your kids love you, your wife loves you. You not being in there in this world is going to make a lot of difference for a lot of people, for me included. I think you should be honest and say things. Probably that will help them understand that, okay, you know what, maybe my life is not that bad. Maybe I have hope. Maybe I can get better.
So has drug abuse and dependency or intake of alcohol affected suicide rates? They have a relation? Is there any correlation between the two?
Oh yeah, huge correlation between drug abuse and suicide rates for sure. Especially alcohol. Most of the people who gather some confidence to end their life usually do it under influence of drugs, because they feel like they're not in their senses as much, and they might not know the pain of it as much. So definitely, if somebody is feeling suicidal, or somebody told you that I'm feeling very depressed, my mood is not good at all, why should I even be alive, or something like that. Never tell, come on, what, let's go party, let's have a drink, it's going to be okay. Don't say that, because alcohol will not make you think straight. It will make you, it can trigger many things, many bad things, and that could be their last drink. So definitely a huge correlation between substance use and suicide.
Right. So how important is it to treat mental health disorders, and how much does it affect in reducing the suicidal rates?
How effective is treating mental health conditions, is it right?
Underlying mental health conditions? for in reducing?
Yeah. Right. So 80% of the times there is an underlying mental health condition. It could be depression, it could be psychosis, it could be bipolar, it could be drug dependence, it could be anything. There are many conditions that can cause suicide as one of the symptom of presentation. But about 20% of the cases, there is no mental health condition. It's a very impulsive step. You fought with your husband, and your husband said, "I shouldn't have been married to you. Why don't you just cease to exist? Or why don't you just disappear from the face of the world?" Out of the anger, and suddenly you take it so personally, and you go and take a drastic step. You maybe go and like drink something, or overdose yourself with medicines or something like that. So 80% of the conditions, suicide requires evaluation and treatment for sure. Maybe 20%, we still have to evaluate them to tell them that you don't need treatment, but maybe a little bit of counseling to understand that to not be so impulsive, not be so reactive to people's comments, and not to be so sensitive. I think, yeah, treatment is absolutely, absolutely important.
So does it run in the family? If someone in your family has committed suicide, you're going to get it, like you're prone to have suicidal tendencies? Does it have
Could it be genetic? The suicide itself, not directly genetic, but the conditions that can cause suicide are genetic. Most of the times when we evaluate a patient for suicide, more often than not, I find there's a family history in the first degree relatives that somebody had attempted or completed a suicide. So could be genetic as well. But again, we need a lot more research to say that no, it's a genetic condition. But again, environment also plays a huge role.
Okay, so would you say that in patient population they should be getting themselves checked for a while, or?
No, I'm sorry, I couldn't hear what you were.
No, I'm saying that in such patient population which have got an associated familial component, is it better to get, like how we have a health check normally, would a psychiatric or psychological check every once in a while help in assessing their mental health?
I think once in yeah, no, for sure, it's advisable. I think once in a year, I think everybody should assess for any mental health conditions, because there's a very thin line between having an abnormal condition or a normal condition. For example, having anxiety, normal anxiety or abnormal anxiety, having normal mood swings versus a mood disorder. There are a lot of there is a thin line. I think it's always good to get an assessment done. In fact, actually, a lot of people come to me for assessment. We think it's not that common in India. That's why when people ask me, is there stigma that this? I don't feel that much stigma because my patients are forthcoming, and I see a lot of patients in a day. A bulk of patients that I see is a lot, and most of them, 95% of them come by themselves. They're not brought or dragged by someone else. So I see that times have clearly changed, and people are forthcoming. Yeah, definitely having a mental health check is very, very important. Even a lot of software companies like Deloitte, I'm not sure if it's Deloitte, but a lot of software companies are sending their employees for annual or biannual mental health checkups. Because I do work in a corporate area, so I do see a lot of corporate clients. So yeah, I think it's.
But they come to you without any symptoms, or do they suspect something and then they're coming to you?
The screening is always without symptoms.
Okay. So when would you suggest, like how frequently should one get checked for their mental health well-being?
See, for example, we being doctors, I think we should get it checked at least like once in 6 months or 1 year, for sure. Especially if you're even if you're studying or practicing, the stress is going to be constant for us. Somebody who is not in as much stressful environment, maybe once in 2 years or once in 15 months, something. There is no hard and fast rule for it, right? But I think frequent would be good. Frequent as in not every week. Once in a year would be good, I think, on an average.
Right. So are you aware of any organizations which are actively working towards suicide awareness and prevention?
See, a lot of organizations are talking about it, right? A lot of organizations are spreading mental health awareness and suicide awareness, prevention awareness, etc. When we talk about help, we'll have to see if there is a helpline, firstly. And if the helpline is it working or not. I put out like so many helpline numbers on my Instagram page. A lot of patients came up to me and told that most of them are not responding at all. Most of them are not even working. It's wrong number or this or that. So I personally don't know if there are any good suicide helplines or NGOs that are helping with suicide patients. I don't know. If somebody knows, please let me know so I can actually help more patients by referring them there. But I think Asra is something that I found that is doing a lot of work. Actually opened some of the tabs. I think there are many names, but I don't know if they're working or not. In India, abroad, there are many functional suicide helplines where there is immediate help that comes to the patient. So I wish we reach there soon, because suicide is the second most leading cause of death in the last 10 years. That's big. We're talking about second leading cause. So, it could be farmer suicide, it could be student suicide. Suicide collectively is the second leading cause in India. That's heartbreaking.
Yeah, it's true. So, how do you behave around someone who has already attempted suicide before?
Yeah, first of all, like don't guilt trip them. That's the most important thing. Already they are feeling guilty for taking such a step, right? So don't guilt trip them. Don't make it about you. I see a lot of family members make it about themselves. Like, like a mother would tell the child that, didn't you think about us? We were taking care of you so many years. It's now your time to take care of us. And now you want to end your life. What will happen to us? Did you give it a thought? I think people make it about themselves. It's not about you. Please be more empathetic and please be non-judgmental. Sometimes it's out of our control.
Right.
Nobody does it for like fun, or nobody does it because they have a lot of time to kill. They don't do it. So just be very empathetic and understanding. And second thing is, this is one pattern that I see in my patients' family. Second pattern I see is it's very hush-hush. They act like nothing has ever happened. It's such a quiet and happy environment. They think by talking about it, it will trigger their thoughts. When somebody is trying to ask also, other family members will shut them down saying that don't ask. He or she is not saying it. Why do you want to again put that bug in their head? It's not a bug in the head, right? Talking about suicide doesn't increase chances of suicide. In fact, it will bring about resolution. It will promote more healthy conversations. Also, how you ask also matters. You can't be an interrogator. You can't be a detective around them. Just be open and tell them that they matter to you, and you don't want anything happen to them, and you won't be same without them. Let them know that be there with them, and follow up with the doctor, please. Most of the patients whom I see in emergency ward, they disappear to follow up. They're lost to follow up. Don't do that. Please come back and follow up.
Right. I feel like the person who is committing suicide, yes, is going through a lot of pain and is in a lot of agony, but I also feel like the people around that person, the closest ones, also suffer to a large extent. So how do you counsel them together, or is there a separate session that is held for them? Or how do you deal with, what are those people supposed to keep in mind? Because even they are affected to a certain extent, right? Because of such a big thing.
So the hospital that I work with, that is KIMS Hospital, so we have a strong referral system. All the patients who had attempted are referred to me, while they're undergoing gastric lavage, or while they're getting antidotes to get better, or in that phase itself, the anesthesia and emergency team, they refer to me. At that time, obviously, patient is not in their own senses for me to actually go and talk to the patient. That's the time for me to actually talk to the family members, right? Understand where they are at, and because first of all, you have to diffuse the gravity of the situation. That you should start from the family members, right? Because sometimes, there is buddy suicide. Buddy suicide is a terminology where you get to know that probably your boyfriend attempted, and immediately you attempt as well.
Yeah.
Sometimes that particular person might survive and you might not survive. So firstly, I personally diffuse the situation of the family. I make them calm and composed. And when the person is medically stable enough to understand what I'm saying, that's when I talk to the patient. Yeah, and this, if there's a need, definitely I interfere with the family therapist, etc. If there are family issues, etc. Yeah.
So, are there any tackling techniques for the family or the close ones who are dealing with such a person in their house?
Firstly, don't blame yourself. You're not responsible. Don't feel like, you know, you couldn't care, that's why this happened, or you were not there for the person, that's why it happened. I mean, introspection and understanding is important. Understanding that probably I should have been there, but don't guilt trip yourself, because that itself, your mental health will go for a toss. Firstly, you
Yeah.
have to be mentally healthy to take care of someone else. So don't self blame, or don't guilt trip your own self. All of that, and don't stop eating, sleeping. Don't do any of that. Yes, there is definitely going to be pain, but you have to go move ahead, because right now you need to be caregiver. So yeah, I think that's my 2 cents about it.
There is a question from Anmol Dave. How to deal with worst days or worst incident?
See, we can always turn the worst days into better days. There are different things. Exercise for me, exercise works a lot. It immediately gives me boost of endorphins and I feel better. Go, maybe make a meal, make a healthy meal, have a group call with your friends, or go through your old pictures or your happy pictures whenever you think you're the happiest in your life. There are photographs for a reason. Photographs are not for Instagram. They're mostly for us to go back and feel what you felt at the time. We feel pain, we feel happiness, we feel love, we feel hatred, everything through pictures. You can live a life through pictures. So go back to that. Uh, I think you can always find different ways. For me, I paint as well. I paint and I make me feel better. So there are different things. There are no just 5 things. There are like probably 1,000 things that you can do to make yourself feel better. I go for drives when it's safe. So maybe that's another way. Listen to music, something that is calming. Do some meditation. You can do a lot of things.
Yeah, that's a good advice. Do you have any advice for someone who's actually having a difficult time? Maybe they're listening to you right now, or they will probably come across this video sometime in the future. Do you have any advice or message for them that you would like to give?
Hang in there. You know, it's very important to hang in there, because uh, right now the amount of pain you feel, the amount of suffering you experience, it's not it's not permanent at all. And only you can change it. Um, when you cross this phase and go back and look at this phase, you will have a perspective about, maybe it's not such a big problem. I was looking at it as such a big deal. For example, if you failed in your exam, everybody else passed, right? You have invested so much time and money and effort into this exam and you failed. You feel like you feel like a failure, right? You feel like there's no hope. Why should a failure let me live? But you know what? Take some time off, especially for medical students. I know it's hard right now. The situation also is not very good. Uh, Move ahead, right? Take some time, understand that why you have failed, and try to build from there. Inch by inch. 2 years later, you're going to be doing a post graduation or an undergraduation, and then that whatever that 1 or 2 years that you lost, it really doesn't matter. It really doesn't matter. At the end of the day, you have to live a happy and productive life. When I say productive, you don't have to be the you don't have to be a gold medalist. I always promote being mediocre and average. It's good if you're average. You know, it's good. You have to be average and happy. That's the most important thing. I don't believe in, like, you have to break a glass ceiling and set some great expectations. No, nothing. It doesn't matter. Just be an average, decent human being who is working and keeping yourself happy. That's all. You live a good life. Trust me on that. That's what I tend to do with myself. So, yeah, just hang in there.
Very well said. I hope it helps someone out there. I'm sure it will. Um, does the audience, if they have any more questions, they can really post it on the comment section and we'll take them. Or if you have anything more that you would like to add from your side, you're welcome to do so.
I think I would like to add to everybody saying that, this is a suicide prevention month or awareness month. Yes, all of us are talking about it. Doctors are talking about it. Councils are talking about it. NGOs are talking about it. Influencers, celebrities, everybody is talking about it. And then when we go to October, we're all going to forget about it.
That's right. Yeah.
Yeah. So I want people who can get the information, who can understand English right now, to go and actually help others in the local languages. Go and talk to other people or let them help more. I think that's what society should do collectively. It's not just I'm doing it for some publicity or I'm doing it to get some patients to me. No, I'm doing it so from me, Dr. Ankita gets to know, and probably she'll help 10 more people. And people, let's just say right now, 5 people are watching it. So these 5 would tell another, 2 people each. So that will become 10.
Yeah.
That's how that should be a chain reaction. I think that's where I want the awareness to go, and this should continue. And don't shy about it. And understand that these kind of thoughts are very, very normal. But what is not maybe normal is like if you're acting out on it. That means you need to get evaluation. So yeah, I think I would like to end on that note.
Okay. That was a really informative and good session, I believe. And I would really like to thank you for being so, for explaining the whole thing in such simple terms for people to understand, because I think it is still a very big taboo and stigma. There's a lot of stigma associated with the talk. So thank you so much for being with us today. And if you could just put on your Instagram handle or your email ID or something so that, if people want to access, reach out to you, that would be great. Thank you so much.
Thank you. Have a good day.
Yeah, you too. Thank you.